Good morning, everyone. It is lovely to see you here. I'm quite excited for this particular event today. My name is Ray Martins. I am a knowledge broker with the Family Engagement and Research Training Program, which is a 10-week course talking about the building of healthy partnerships in health research. If you have any questions or would like to learn more, you can read more about it at furprogram.ca. And as I mentioned, I work as a knowledge broker with the research program team. So I'm more than happy to have a conversation about any sort of needs that you might have associated with this, or even just questions you want to have coffee about, things that are concerning you around patient and family engagement, things like that. I am always down for a chat. Today, we are very fortunate to have actually a whole team talking about youth engagement, but a number of folks as well are grads of the course as well. Um, and I just I'm excited to learn a whole lot more from this very wise group of people here today. And before we get started, before I hand the microphone off, I just wanted to take an opportunity to acknowledge the traditional territories of the Treaty 7 region in southern Alberta. The city of Calgary is also home to the Métis Nation, Districts 5 and 6 in Alberta as well, too. And this is a picture of where I live out in Calgary right now with the ice crystals in the air and the hoarfrost on the trees. It is quite the wonder, and it does really offer opportunity to reflect on our relationship with the land and how we grow and build this world that we exist in together. So as we move forward here, I am just going to stop sharing and hand the mic off to, I'm not sure who is wishing to start the introductions, but I will just come off my, or turn my mic off and hand it over to you.
Thank you so much, Ray. We're thrilled to be here. Thank you for the warm welcome. I'll take a moment to share my screen, and then all of us will give a brief introduction to ourselves in just a moment. Okay. So here we go. Hi, everyone. It's a thrill to be here with you today. I'm joined by three wonderful colleagues, and the four of us will be discussing a topic I think we're equally passionate about, which is around youth engagement in research. And we'll share some of our insights and learnings around combining both evidence-based recommendations from the literature and youth perspectives on what it means to do this work ethically and meaningfully. So before we dive into the presentation, there are four of us here, and I'll begin by introducing myself and then hand the mic over to Alene. My name is Brooke Allemang, and I'm a passionate collaborator committed to meaningful partnership with youth and families in my work. Having spent many years on the front lines as a hospital social worker and now as a researcher. I work as the program manager of research and implementation in the Office of Patient, Family, and Community Engagement at the Hospital for Sick Children, where I aim to amplify youth voices in research and in strategic planning. And I'm also a proud aunt to 8 nieces and nephews, and I love the outdoors. And I'll turn it over to Alene if you want to introduce yourself.
Thanks, Brooke. Hi, everyone. I'm Alene Toulany. I'm an adolescent medicine specialist pediatrician at Sick Kids in Toronto, also an associate scientist at our research institute. So really excited to be here with you today. I'm also from Halifax, and I love being out on the water. So I'll pass it out on to Katherine.
Hi, everyone. I'm Katherine Bailey. I'm a psychiatry resident doctor at the University of Toronto and at the Centre for Addiction and Mental Health at downtown Toronto. And I actually just recently finished my graduate studies under the supervision of Alene. So I'm a very early career researcher that's getting interested in this space. And I'm also, Brooke, into the outdoors. I'm a huge avid hiker, but I unfortunately have not yet been to Calgary. So that's on my list.
Hi, everyone. And just reiterate, Ray, thank you so much for that warm welcome. It's really an honor to be here with my co-presenters, Sarah Munce. I'm implementation scientist at Holland Bloorview Kids Rehabilitation Hospital. Really passionate about this space of youth engagement in research and understanding and identifying the processes that are meaningful to youth in that engagement process. So, doing quite a bit of work in that space with my colleagues here. Like the others, also very, love the outdoors, love being in nature. And as I learned from a recent implementation science community of practice, I think it was, Peloton enthusiasts, and I know that there are some others in the group that are also Peloton enthusiasts. So that was great to see. Looking forward to a great discussion today.
Wonderful. Thanks, everyone. Before we move into the bulk of the presentation, we also want to acknowledge that all of us come into this work and presentation from the lenses of researchers and clinicians. So we'll be drawing on our learnings and experiences engaging youth in a variety of projects, and we'll speak to one paper in particular. We do want to just take a minute to really gratefully acknowledge all of the youth advisors, collaborators, and our colleagues who've contributed to the paper that we'll be speaking to, and to so many other youth advocates, partners, and collaborators who have informed our thinking about this work, some of whom I think are on the call today. So this work really takes a village, and while we're sharing our perspectives, we'll also be aiming to amplify some of the voices and experiences of the terrific 11 youth advisors that we've worked with on the project we'll share today. So thank you so much to everyone who's informed our thinking. Over the next probably 40 minutes or so, the four of us will describe what youth engagement in health research is and take a minute to reflect on how this form of engagement is differentiated from other forms of engagement, including adult patient or family engagement. And then we'll also highlight some strategies, tools, and approaches for engaging youth in research using a particular case example of a project that the four of us worked on together. And we'll close out by really sharing some real-world challenges, reflections, and possibilities around what we feel the future of youth engagement could look like. And we'd really welcome your thoughts around that and hope for an engaging discussion. If any thoughts come to mind, you're welcome to put them in the chat as we move through the presentation so we can come back to them at the end. Now, we thought we would kick off this presentation with just a moment for reflection, and we'd encourage all the folks on the call to think about either a particular word or a phrase that comes to mind for you when you think about youth engagement in research. So I'll give you a minute to reflect, and we'd invite you to share those in the chat. Thanks, Leslie. I see consent in there. That's a really important point. Creative, energetic. Safe, agency, empowerment. These are all such beautiful words, and also I think important considerations for what it means to do this type of work with youth and young people in particular. Community, collaborative, and my voice matters. Yeah, thank you all so much for your reflections, and I see they'll continue to flow in. A lot of the points you're speaking to, I think you'll hear threads of throughout the presentation. Great. And just to get a bit of a pulse check on the virtual space here today, we also wondered if folks have experiences either being engaged or engaging youth as partners in research. So if you're able to use a reaction, raise your hand, or even put yes or no in the chat, that might help us understand who's in the room today. I'm seeing some yeses. And Julia, I see a question coming in around age. And I think Alene might speak to that in a moment. I can say, I think the World Health Organization defines youth as age 15 to 24. But I have to say there isn't sort of a total consensus in the literature on what this discrete age group looks like. But I'd be open to hearing Alene's thoughts on that, maybe on the next slide. Okay, thanks everyone.
Okay, thanks, Brooke. So these are some of the words that come to our minds when we think about youth engagement. And one of the main goals of today's talk is to really highlight what the differences are between youth engagement and other types of engagement, like with adult patients, with families, and with children. And so A lot of the principles that we use with other groups do apply to youth engagement, but there are some distinguishing features. And many of these we're going to talk about today relate to youth's developmental stage. So typically, when we talk about youth engagement, we're referring to the involvement of young people, adolescents, and young adults. Adolescents and young adults, the definition varies depending on where you look. I like to think about adolescents being anywhere from 10 to 18. That aligns with the WHO and the UN. And young adults typically go up to age 24, sometimes 26. So, within that age bracket is typically what we mean by youth. And it really depends on the project's goals and foci, which will help you determine what age group to work with and partner with. So what does youth engagement mean? So we're referring to involvement of young people in meaningful opportunities and roles throughout the research process. And when you do this well, youth engagement allows young people to build on their strengths. You can see that is the biggest word that we have highlighted. It allows them to take on responsibilities, and it allows them to contribute to the decisions that we make together that affect them and other youth. One of our overarching goals of all of the work that we do with youth is to both produce and also to share knowledge that's relevant to them. One of the things that we've learned along the way is that, before you start, take a moment, take some time with your team to think about, what is important to the youth that are involved in your study. Think about their age bracket, think about what they're doing at this particular life stage. So oftentimes what we've seen is that they're facing quite unique challenges related to their transition to adulthood. It might include, moving out of the family home, thinking about different types of education, whether it be vocational training or other forms of post-secondary higher education. They're often developing a sense of autonomy, trying to figure out who they are as people. And adopting new roles. They're adopting new roles both within their families, but also in their relationships, both romantic and within their peer relationships. Youth are often, especially older youth, are thinking about their future. They're often looking for opportunities to develop new skills, expand their networks, and they're looking sometimes, and often I would say, for mentorship. So the last thing I'll say to this slide is the word power there. It's small, but it's actually very important that we as a research group think about the power dynamics in our relationships with young people. Some of the reasons for these power dynamics, they're multifactorial, but age biases frequently come up among among adult researchers. We've also seen that young people are coming where they've had, unfortunately, quite negative experiences, either with the healthcare system itself or through their research partnerships. So really careful attention to these power dynamics is essential to making sure young people feel heard, and also in order to build trust. Next slide. So why do we do this work? There's so many reasons. These are probably our top three. So we would argue that it's morally imperative to involve young people in research where it involves them, where they're the subjects, or when we're designing programs where they are our primary targets. This will ensure that our outputs are youth-friendly, that they're accessible, that they're relevant. We also know that when we partner with young people, our approach to the study, our study design, the materials that we make are more relevant and also aligned with what young people and the community needs. We've also seen that involvement of young people really does help with our study recruitment, because our materials make sense to young people that we're trying to recruit, and the importance of the project and the study resonates with the young people we're trying to recruit. So it really does help with study uptake. The last thing shown on this slide is probably the one that I value the most, and it relates to the youth researcher partnerships. Reciprocity and co-learning really underpin a lot of the work that we do and the models that we use in youth engagement. When I think about some of the skills that youth have brought forward to our teams, many of them are experts at using technology, social media. Their creativity really shines through in terms of the materials that they produce, their graphic design skills. And oftentimes their understanding of the healthcare system is obviously very different than mine, being on the other side. So it's really important to hear their perspective and their lens on what it's like to enter and what their journey is like in the healthcare system. And we as researchers also can offer mentorship, training in research methods. We've had young people come to us looking for support with their resumes, also looking for networking opportunities. So this reciprocal learning environment really does benefit everyone. And for me, and I think many of my co-presenters, is probably the most rewarding part. And we've seen it help shape trajectories and paths moving forward. So next slide. Okay, so these are some of the benefits of youth engagement from the perspective of the researcher, but also the youth partners. So we've already mentioned a few of these things, but I'll just highlight that for us as researchers, we definitely get new insights about our research topics, our questions, the relevance of our work improves, the material is more understandable, more readable, more accessible. The consent forms, the tools, the questionnaires, and the actual interventions that are implemented. We've also had the privilege of helping or working with young people to help us interpret our data. So really asking young people what findings stand out to them and why, and what their interpretations are. And it's often very different than the lens that we bring as researchers and clinicians. And then when you look from the youth lens, there are so many positive benefits that we hear about. These are different for everyone, but these are some of the common things that we hear. So oftentimes young people are developing new knowledge, new skills, their confidence and self-esteem is improved. There's lots of opportunity for personal growth and for, one of the things that we've loved to see is opportunities for co-authorship on our publications, opportunities to present, opportunities to go to conferences together. Next slide. So many of you on this call are likely familiar with the wide spectrum of levels of patient engagement in research. They can range from anywhere from participating as a subject in a study to being directly involved in the work to also leading the work. So we've been fortunate as a group to work with young people at these various levels, but today we're going to share a case example of a research project where young people were engaged at the involved stage. So you can see here we work directly with young people in an advisory capacity. And the goal of this work, which you'll hear more about now, was to learn about the topic of youth engagement from their perspectives.
Terrific. Thank you so much, Alene, for that wonderful background. I think that provides important context to what we'll be sharing. So to kind of build on what Alene was just speaking to, our team really had this desire to understand the state of youth engagement in health research. And so we undertook a narrative review of both the published and unpublished literature on the topic, and then developed an advisory council of 11 youth from across Canada who could complement the review with their expertise, lived experience, and their input. And we just want to note to the point Alene just made around authorship that all 11 youth advisors who contributed to this incredible work are listed as co-authors here. And you're welcome to scan the QR code if you'd like to learn more. So we thought we'd take a minute to talk a little bit about what it looked like to develop this Youth Advisory Council and provide a bit of an exemplar that walks you through some of the steps we undertook. So in forming the council, a youth research partner and I held individual meetings with advisors from across Canada who were interested in being involved in the project. And in those sort of individual meetings, we attempted to understand their motivations for involvement. We asked them about desired meeting times and some of their preferred channels of communication. And then we all came together as a group at our first meeting, and at that time we oriented members to the project as a whole and held collective discussions about how to build brave spaces in the context of a virtual engagement opportunity. A terms of reference document, which you'll hear more about later in the presentation, was developed by our team and then refined by youth And we use tools, some examples of which we'll show next, to help determine youth advisors' areas of interests and desired tasks throughout this partnership in order to support youth advisor autonomy. We use technology to support group processes, including a shared drive, which allowed all members of the team to collaborate asynchronously on study documents, and a youth-initiated and youth-only Slack channel so that the youth could communicate with each other outside of the confines of our virtual meetings. As a team, we sent out meeting agendas and materials in advance for clarity, and we invited youth advisory councils to co-chair meetings to share some of that power and provide opportunities for leadership. So this flow diagram here comes out of the paper that we just shared, and this was actually developed by the youth advisors on our project to document our processes of engagement. So we talked a little bit about recruitment sort of and onboarding already. And here I want to emphasize this was quite a time-limited engagement opportunity. And it was really important for our team to be transparent about what this opportunity would entail from the outset so that we were involving people in an advisory council position over about a 3-month period, which would involve several meetings over teams and provide opportunities for co-authorship. It was really important for that transparency to come through so that people had a clear sense of their roles, responsibilities, and could think about whether the opportunity was a good fit for them. I want to share an example on the next slide of one of the activities that we brought into one of our initial meetings with the group. So we used a combination of different tools, including Google Jamboard, which unfortunately is no longer available. But I think this was a really great tool that allowed us to collaboratively develop and think about ways that the youth advisors wanted to contribute their input to the review paper. So you can see we collectively made some decisions about how the young people would be involved in looking at the information our team had compiled from the literature. So I want to highlight a few key areas here. What came through loud and clear from the youth advisors was that they wanted clarity on what their roles and tasks could look like in this review paper. And they wanted to use some sort of tool to allow them to rank, well, express their interests and then rank what they might be most interested in. And actually, we used this to develop another tool that helped people select and rank the opportunities they were interested in. And that allowed us to develop smaller working groups so that young people who were interested in working on graphics, for instance, could go off and do that together. And it worked really well and was quite youth-led and initiated. So here this sort of graphic from a couple slides ago continues, and I just want to emphasize that we worked together to develop a meeting structure that worked best for everyone and quickly determined that those smaller working groups to allow people to work together outside of these large group meetings would work really well. Members then had a chance to come together and present the outputs they developed through their smaller working groups to our large group. And I think this was a nice scaffolded approach where the research team was available to support young people who had questions or required any training or insights on particular topics, but allowed them to take the lead. This really gave youth autonomy over their contributions and a chance to connect with each other in youth-only spaces. And the last thing I'll emphasize here was that we embedded anonymous feedback forms at a couple time points throughout our partnership and did our best to incorporate the feedback we were getting from youth along the way into our meeting structures. So some of their feedback was around making more time for collaborative discussions in meetings and less didactic conversations. So we ensured that we embedded that in our processes. On this next slide, I'm going to share an example of a video. And I think this is one area that stood out to me as being so impactful about our paper. So 2 of the youth advisors on our team wrote reflections about their experiences being engaged in other projects, and their word-for-word reflections are available in our paper. And this video kind of walks through 2 potential experiences that a youth could have being engaged in a research study. So things that might go well and things that might be challenging. So here's a video that you hear youth's own voices in that helps to capture a couple different ways this could go.
Well, meet Madison, a youth advisor working on a research project who was told, "This project is in your hands, and you call the shots." A project where youth were not just participants, but decision makers, amplifying Madison's confidence and empowering her to leap into more research adventures.
Gianna over here, however, had a very different experience in a research project that she was involved in. She put in a lot of effort and time to share ideas and help out, but she discovered that the researchers weren't using any of her or her peers' input in the final project, despite saying that they would. It was like shouting into a void. Her experience shows us that just being involved isn't enough. The lack of impact can drain the spirit and dull the spark of young advocates.
Madison's empowerment and Gianna's disappointment tell us something vital. Engaging youth in research must be meaningful and conscientious. And it takes time, a lot of time. It's not just about intent. It's about impact, trust, and mutual respect. So how do we make this happen?
Well,
So I just love hearing that, especially from the perspectives of the youth who are involved in this work. I just want to emphasize a couple key points. And I'd invite us to all reflect, I guess, as we move through the discussion about what lessons we learn about engagement and how we can make things better for the youth that we partner with. So in Madison's case, we heard about an experience where the project was really youth-led. Youth's voices were prioritized and actively engaged into the project. And this resulted in feelings of confidence, empowerment, and encouraged her to dive into other research opportunities. And on the other hand, Gianna was consulted at a number of time points in a project within a large organization, but really had this experience of feeling like her voice wasn't being thoughtfully considered. The feedback she was offering, the time she was putting in, felt like it was going nowhere, and there weren't any feedback mechanisms to describe how it was being used. And this left her feeling really tokenized, powerless, and defeated. So we'll talk through some considerations for how we can do this in a meaningful way on the next couple of slides.
Thank you. So through a review of the literature, which was then complemented by our youth advisor's experience and expertise, we synthesized a series of barriers and recommendations for youth engagement in health research into several different areas, which you can see on the screen, which included youth level, researcher level, organizational level, and then systems level. Next slide, please. So here's an example of how we compared what we found in the literature to the perspectives of youth regarding these barriers, specifically around mistrust and knowledge, as displayed on the slide. So we can see for the youth level barrier from the literature, it identified mistrust in the healthcare system, which could include mistrust within their healthcare providers, but also within research teams. This was then complemented by the youth perspectives to identify also encountering a culture of individual learning within the research team, but unfortunately not being provided with appropriate support to navigate this culture. For the researcher level, the research identified a lack of knowledge that researchers have about how to actually engage or communicate with youth appropriately. And the youth complemented this to say there's also a competitive attitude in the research space that can sometimes breed unhealthy and ableist attitudes. Next slide, please. So here's a snapshot of the recommendations section of our paper. And so you can see how the youth elaborated on and really expanded the recommendations from the literature. And they did this with each of 8 sections that the literature identified to provide more fulsome ways forward in the area of youth engagement. Regarding recruitment for engagement opportunities, youth highlighted the importance of being transparent about commitments, tasks, and expectations, as well as transparency about methods for compensation right from the outset. Closing the loop regarding how youth input was actually used to inform concrete changes to the research outputs, and also focusing on youth's preferred method of communication were also described by youth in our paper. Next slide, please. So here we're going to continue on the video that Brooke showed earlier that's going to demonstrate in the youth voice some strategies for meaningfully engaging youth and envisioning a way forward from some of our youth advisors.
By co-developing research questions and methods with youth from diverse backgrounds, providing opportunities for leadership and mentorship, and establishing flexible engagement practices that are youth-led, you can steer clear from tokenistic involvement and truly benefit from our insights.
Imagine a future where research spaces are shaped by the rich tapestry of youth voices, experiences, and expertise. When power is shared, practices are grounded in community wisdom, and youth research alliances are robust and healthy.
Let's transform our research environments into spaces where youth are not just seen, but truly heard and valued. Let's ensure that their ideas aren't stifled by a lack of resources or support. Together, we can create a research environment that is empowered by the unique and valuable insights of our youth. Because when youth are actively engaged in research, we're not just solving complex puzzles, we are reshaping the future of healthcare. Join us in amplifying and empowering youth voices in health research.
Thanks so much. We've touched on of course, the many benefits of engaging youth in research and partnering. But it's, of course, important to not acknowledge that there can be some challenges and risks. And Alene touched on that a little bit at the outset of the talk. And of course, these considerations are amplified when we are partnering with youth. So of course, we need to consider, power dynamics, right? And again, that there is, risk of harm for, people of all ages. But again, this is amplified when we're partnering with youth and, who have, yet to determine, their specific paths, and they are carving out their futures, right? There is, risks of harm, re-traumatization, mistrust of adults and the healthcare system as a whole. If we don't do this work meaningfully, right? And we heard that with Gianna's experience in the video, right? Really feeling that mistrust, defeated, powerless. And tokenized, right? And increasingly, this is being written about in the literature. Of course, there are ethical issues as these processes. There is no one way to engage with youth, and there's risk of youth feeling unsafe in these partnerships. So of course, ethics boards have protections for research participants, but those protections are not in place for youth partners. So there is certainly a need to develop, governing bodies or accountability structures for engagement to support and protect and advocate for the rights of partners. Especially for youth from marginalized groups and other groups that are experiencing vulnerabilities. There are, of course, structural issues, and this has been a topic that has come up in a number of circles and a number of conversations of late. To do this work meaningfully, it takes time, right? This is about building relationships, building trust, building community, and this is really not accounted for in funding structures. So there certainly is the need to have funding to establish those relationships, to build trust, to build that community, especially when we think about some of those power dynamics and potential for power imbalances. Another issue that we are looking at very closely is evaluation, right? The need for continuous feedback and feedback mechanisms to promote accountability, and that feedback or those mechanisms or evaluations should be youth specific to capture what is meaningful to them. And certainly, governing bodies may be required to ensure that youth feel safe and they have access to supports throughout the engagement process. Next slide. So in terms of what we feel is needed next, it's these are in line with some of the challenges and risks that we have identified, as well as ways that we can amplify or promote the benefits and the enablers that we've identified. So the need to prioritize frameworks and research focused on engaging youth from equity deserving groups. So what existing frameworks are relevant or could be adapted specific to the needs of youth, and particularly youth from equity deserving groups. As I mentioned, really this need to address some of the structural and systemic issues with engagement, and again, I feel like this has been a conversation of late. Certainly, when we look at I think there's significant potential with granting agencies in terms of providing funding for to help establish and promote those relationships, which in turn promote trust. And certainly the need to establish youth-specific evaluation tools is one area that we're looking at. We're very keen to develop. So to develop a measure for youth engagement in research, and what are those meaningful components, and potentially how do we prioritize those components. Next slide, please. So as we wind down our conversation today, so we'll just put forward some reflections and possibilities for youth engagement in research. These are anecdotal and based on our collective work, so I will emphasize that. We think that there's a lot of exciting opportunities in terms of recognizing, acknowledging the contributions of youth when we do this work. Of course, we're having a lot of conversations about, and rightly so, about the need to properly compensate youth. And in addition to that, we should also be having conversations with youth about, how they would like, how they would like to contribute and how they would like those contributions acknowledged. And there's, a range of possibilities, right? So, Alene mentioned co-authorship on papers, but we've also seen, of course, and Alene mentioned it as well, networking opportunities, development of skills, etc. As part of this process, there's certainly a need to be more explicit about, processes and outcomes. So, where and how youth would like to be involved in the research. What is meaningful to them? Is it being involved throughout the research cycle? Are there certain areas that are particularly relevant to them? Those are very important conversations and important ongoing conversations, right? We also touched on this idea about being purposeful about reciprocity. Oftentimes in teams, we there's the risk of talking about, what youth can provide to the research project or the research overall. And we would argue that, we need to be having more conversations about what we can provide to the youth that we partner with and provide us with so much. So what is meaningful to them? Is it co-authorship on a paper, skill development, facilitating networking opportunities? I think we need to be again having those conversations early and on an ongoing basis. And we, collectively are really interested in, in the benefits, the great benefits of engagement in research. So thinking about the outcomes of these partnerships, including, peer support and mentorship. So youth will tell us that, as a result of their involvement in these projects, they feel sort of less stigma associated with their particular condition. They have an outlet to share their concerns and frustrations. So that's another great benefit that we hear from the youth that we partner with. Next slide, please. So very, very timely, but very timely. We have published a paper. It actually just came out yesterday on co-developing a terms of reference for patient engagement in transition research, and the context was in some ongoing work on developing quality indicators in healthcare transition. And this was really in an effort to be explicit about the processes of engaging with youth as well as other knowledge users in our research process. And so some areas of that terms of reference included, the roles and responsibilities that youth would hold, what could be some of the expected outputs, what were our values and principles, how were decisions made. And we thought that this terms of reference would be very helpful to other researchers doing this work, and are very, very excited to have published the work. Next slide, please. So as I mentioned, just came out yesterday in November 28th, that was yesterday, in Health Expectations, co-developed with our IKT team. And we share the reference here, and the co-authors are listed here, and again was developed with our IKT team. Next slide, please. And that concludes our presentation. And at this time, we'd love to answer any questions the group may have, or engage in a discussion. Thank you very much.
Thank you so much, everyone. This has been a wonderful thing to listen to, but also I learned a lot more. I will say one of my blind spots is youth engagement in research, and to learn about some of the values and just how just some of the foundational principles as well too is just a really important one. If anybody has any questions, you are more than welcome to either add them to the chat or come off mic. We would love to have a conversation with you today. Dahlia, you've got your hand up.
I think you're muted, Dahlia.
Oh my God, that's hilarious. Thank you, Brooke. I was saying thank you so much for this presentation. Youth engagement and research is a topic that's really dear to me because I'm a former youth advisor. So it's really cool to see the research being done on it. You mentioned transparency about how feedback will be used, and I think that's a really important consideration. I'm just curious about how um, to best manage expectations of advisors. How do you sort of communicate if or what areas of the study are not amenable to change or where input can't be reasonably or feasibly considered? Just because I feel like not incorporating feedback because it can be budgeted for versus because researchers don't agree with it or have different implications. And do you think that there are like objective criteria for what is a reasonable justification for not taking feedback? Or should that criteria be co-developed or included in the terms of reference as like part of the decision-making process? Just your thoughts on that.
I can kick us off and then please feel free to join in, team. So I think the way we've approached that is to have a terms of reference which speaks to that very issue. So how are decisions made? And like you said, when and where may it not be amenable? So I think sometimes the research design might drive how much of that input can change. But unless it's an RCT, right, that's underway, I think there's a lot of opportunity for things to shift and mold. One of the things that we've found helpful is for young people to share that with investigators themselves can be quite challenging. So having an advisory panel or a knowledge translation panel, which is chaired by a young person themselves, obviously with support from the team, helps for some of that feedback to get to where it needs to go. Also, anonymous ways to share feedback is really helpful. And the role, I think, of the research team is then to loop back via the young person who's chairing the panel with how we've used the feedback or not, and if not, why not? So again, it's about transparency. Not every decision can be taken in its fullest form, but we owe youth an explanation for why.
I really love that explanation. One thing that we do teach in our program as well too is the notion of psychological safety and the fact that that shifts and changes depending on the subject matter that a person is approached with. There might be moments where you feel like you are the quiet person in the room for very good reasons. Sometimes you might feel like you can speak up fully to the extent of what you wish to do so. And that might move back and forth, but to have the options where you might feel like you are lower on the participation spectrum when it comes to being able to speak up, those options are very accessible. And that also talks about too, that it's not just accessibility from a logistical disability standpoint, but also there's an emotional accessibility as well to that. Karen.
Is it still morning? No, afternoon. Question probably more directed at Alene than anyone else, just because she's an MD in this case, and I'm wondering about I may have missed it because I came late from another meeting, but how you potentially address I'm going to call it conflict of interest, Alene, but I'm not quite sure that that's exactly what it is. So, MAC is not nearly as big as Sick Kids. I know other institutions, we've been talking about this, Delia, Kim Courtney and I, others, about this potential where you have a research partner that you may have cared for clinically, directly, indirectly, and how you kind of navigate that, you've partnered with a youth member on a research project, and then 6 months later they end up inpatient and you're on service, and things are not, you don't have a regular clinician patient relationship. And I'm just wondering whether there are, I don't know, some kind of boundaries or just discussion points that you could have with the youth beforehand about if I ever care for you, or I've been your doctor in the past. Do you have a time frame? I know we talk about, you shouldn't, in the neonatal intensive care unit environment, we give patients generally like a 2 to 3 year, you shouldn't come back and partner and do anything until you've been discharged from hospital for a minimum amount of time, because this could be triggering. So just wondered what your take is on those relationships and how they can be different, and maybe preventing any kind of conflict from happening. Maybe it's unavoidable, and what do you do?
Yeah, thanks, Karen. Those are the exact reasons why we need to start thinking about the ethics of engagement, and who's going to be responsible or lead this work. I think it needs to be done together with Research Ethics Board, but they need to understand the differences of research subject versus partner consultant advisor. These are the types of things that should probably go into a terms of reference when there's a possibility that somebody on the team may be in a situation where they're providing care. I would say that would be a big conflict of interest for me, and I think many of my colleagues would feel similarly. So in that situation, if I wasn't able to remove myself from the direct care, like asking a colleague to come in and take my place, I would have to do it in the research space. So making sure that, I wasn't leading meetings where I was soliciting feedback. So yeah, just being really careful about the power and the hierarchy that may ensue because of those relationships. Anyone else have thoughts?
I know our ethics board doesn't, they haven't touched this yet. And maybe for good reason. I just don't think it's within their kind of a comfort zone at the moment or what they usually deal with. And I don't know if there's like rules with flexibility around it. We've talked about it extensively, but I think, at institutions where, staff might be larger, Alene, and you can maybe remove yourself. At other institutions, when you're in allergy immunology and there's only two of you, at some point you have a patient that's informing you on your research, there's going to be, it might be very likely to happen. Yeah.
Totally.
Thanks for your comment.
Go ahead, Sarah.
Yeah, I'll just jump in and say that absolutely, Karen, like, thank you for the questions. It's a really important area that's, ripe for sort of further work. I know there's a patient partner on a project that I'm working on that's explored this in more depth. And so I'm happy to send along to you or to the group a report that she's recently written. I think it was last year. It's Lynn Laidlaw. And yeah, it's definitely, as Alene mentioned, come up in our work on the quality indicators work in terms of, who leads the IKT panels. We thought about, do we hire, a third party? So yeah, definitely, have given it some consideration, and I think there's, it is the old. There's more work to be done in this area, and it's certainly something that is top of mind when we do the work. Yeah.
I would throw into the mix as well too. This is something I've been randomly thinking about as well too. Is as those considerations are being developed, how we can, alongside what might be perhaps a child has been in the participatory or partnership sphere for a while, initially starting with the parents or caregivers, how we transition to that, like how we transition youth to the idea of partnership in that capacity on their own, what it means to connect with their parents and have those conversations when it's appropriate as we develop these ideas as well.
For sure. And even as those youth partners age out, right? Like as they transition from a youth partner role, right? It, has its complexities.
That's a very great point there. We have some great questions here from Sunny. One of them is, what are your thoughts on a national youth and family engagement community of practice?
I love it, Sunny. I think that's such an incredible idea. And I know that these communities of practice exist, in other spaces and for other groups who are focused and passionate about patient and public involvement in research and even clinical care, but not so focused on youth. And it's interesting. I think there are many national youth advisory councils and lots of different boards and teams doing this work, but I feel an opportunity to bring everyone together to share learnings. Some things, you don't want to standardize everything. We recognize this is very relational, this work, and is a process, and that's like the fun, creative part. But if there are learnings we can share with each other to improve what this experience looks like for people across the country, I think that could be outstanding. I'd love to chat further about that, Sunny, if you're interested.
I think there's so much to be said about human behavior as well too. Like my spouse works for a telecom company, and every time they talk with people, they have something called a safety opportunity for meetings, where if something went slightly awry or, there was an accident or things like that, you have that opportunity to learn, reflect, and think, what would you do in that situation? These communities of practice definitely generate a lot of those types of commentaries. The other one is, what anecdotes can you share about navigating disagreements? And then after that question, we will head to Jana as well.
I would say, yeah, around disagreements. I think it's such an excellent point. There are many challenges that can come up in this work. I would say, in terms of like getting through a tough situation, or if there's a case where feedback can't be incorporated, for instance, to come back to Dahlia's point, I think that's where the value of relationship building really comes in, and something that I've always tried to prioritize in my work in this space. And just being really transparent about things as you move through, taking the time to understand different people's points of view, just like you would in resolving conflicts on any kind of team. And I think the other piece I'll say is, I think a really important future direction in this area is to think about feedback mechanisms, and we touched on it in the presentation. So if there are challenges, conflicts, if things aren't going well, like, is there a third party or a process we can implement so that a person feels safe on a team in order to express a grievance or get support that they need that might be outside of the team that they're working in? So that's something that, myself and many colleagues have been reflecting on, and yeah, open to hear others' thoughts as well.
I'll just add that we talked a little bit about this, but this type of engagement takes a lot of time. And if you're rushing through, it doesn't allow for these things to come out. So I think it would be expected that there would be disagreements. So to say that at the outset of the work that, not everything is going to go smoothly, there will be bumps in the road, there will be things you disagree with us about, and we are going to explore that together, which means it's going to take probably longer than you anticipate. So thinking, really thoughtfully about the timelines before you embark on this work. And I'll also say we haven't had that many experiences where there have been disagreements, but I will say that we have had times when young people or even older people have been triggered by the topic area or what's being discussed, and people have come to us saying, they needed a break or they needed to pause from the work. And so discussions have been held around those sorts of things.
Well, thank you for that, Alene. Jana, I know you had your hand up. Did you still want to ask a question?
Hi, thank you so much for the wonderful talk. It's definitely a lot of reflection. I have a question for the research team, particularly in working with youth with marginalized backgrounds. I know that Professor Munce have touched on it earlier, and we recognize that they might face unique challenges and barriers in terms of participating with the research process. I'm wondering, what kind of strategies or approaches have you found to be effective in engaging with youth from marginalized backgrounds, and just ensuring that their voice and lived experiences are represented throughout the data collection process?
Yeah, thanks. I really appreciate the questions. Yeah, such an important question. I mean, I think, we've said it many times. I think certainly, and this is why we felt so passionate about it, so excited about it. I think the terms of reference, or, we call it terms of reference, but, ways to establish early on, in that engagement process, ways to do the work meaningfully are, is one way. Don't maybe necessarily need a terms of reference, although, we have, provided an example of one. So I think it is about, having those conversations early on about, how to meaningfully engage those youth. I think, we touched on it, and I don't have, the best answer. We all said, this work takes time, and to, reach those individuals, those youth that, aren't, at the table for a variety of reasons, to identify those individuals, to meet those individuals where they're at. That takes, time and effort that we may not have the resources for. So that is certainly an ongoing issue. I think that needs addressing. And then I think the other piece I'll say is the compensation piece, right? Recognizing that we need these partnerships. We need this expertise that those youth provide, and they need to be adequately compensated for that expertise. So I think we are making some progress on that front. And I think the last thing I'll say, and again, the team touched on this, is I think part of, there's many reasons why we're so excited about this work, but one of the reasons is the opportunity to provide youth with opportunities for skill development, networking opportunities, peer support. And I think that, for vulnerable youth, marginalized youth, I think this work really can provide some incredible opportunities. So those are just some reflections I have. Thanks for the question.
Thanks so much for that, Sarah. We're going to have one more question. My apologies, Uzma. What I do want to encourage before I ask this, though, is that one thing that we like to do as a family engagement team is to encourage the notion of networking and connections. If you feel like you have further questions about the work that this wonderful team is doing, consider connecting with them over email or through some of their social media outlets and things like that, where you can ask about this further. Scientists love talking about their work. That's what I hear this a lot. But anyways, do find the time to ask those questions if you can. Cynthia asks, any suggestions when clinicians in allied health are unwilling to share engagement opportunities with family and youth, feeling they don't want to overburden or pressure them because of the power imbalance? Any thoughts?
I'd encourage teams to look outside the clinical network, so to broaden recruitment to patient groups outside of your individual network helps. Sarah, any other thoughts, or Brooke?
Yeah, I think asking the partners you do have, about their, like, a bit of snowball sampling, right? Asking, so I'm just thinking about one particular project. So we have asked our a youth voice representative, our lead IKT panel member, to reach out to her networks, to diversify our youth panel. Yeah, it's a great question.
Yeah, maybe the last point I'll say, Cynthia. So if folks feel unwilling or are unwilling to share, it's also, there may be ways of communicating these opportunities and framing them in ways that perhaps don't feel pressuresome. And I would also say, like, giving people certainly the chance to opt out, but also the chance to opt in, because there might be people within these networks and clinical spaces that are really keen and motivated and would love to share their voice and experience, but just aren't aware of the opportunities and then might miss out on those. So there could be some immense benefit to involvement. So maybe not assuming that they'll automatically feel pressure, but finding ways to communicate these opportunities or provide channels that they can anonymously express interest, so that sort of pressure is removed while giving people autonomy.
That's a very solid point. From a caregiver side, as someone with lived experience, I can definitely say that there is a real sense of power that comes from choice, because that's not necessarily put in the hands of people who are from marginalized populations as well. So to ask the question first off and allow them that opportunity to say whether or not they wish to do that, but to safeguard that as well too, because in some cases you don't know the scope of what it means to devote your time to a particular thing until you try it out and see, and you might see the whole system of your life of caregiving or whatever the case may be, or as a person with a chronic condition, it just might collapse around you and you just like, nope, I can't do that. But the key point here as well too with that, with potentially maybe doing a trial period or something like that, is that step forward for someone is really unbelievably brave. That takes a lot of courage to step into these positions. And so when we offer people that space to do so and say like, yes, this is working for me, or no, this might not be working for me, we've really given somebody a gift in that capacity as well too. So I wanted to say thank you to this wonderful team, to Brooke, to Alene, to Sarah. And I'm sorry, my neurodivergent moment here, Catherine, my apologies. Need more coffee here this morning. It was been wonderful to have you here today, and we are quite grateful to hear about all of your hard work. There will be a recording on our YouTube channel, and I will send all of that information once it's recorded out on Luma as well too. Thank you again. Have yourselves a wonderful weekend.